Good morning and namaste. Uh, Welcome to Sai Interviews. And we came back with one more dynamic speaker and a very good friend of us and guide, our mentor and Manojagriti well-wisher. Ma'am, namaste. Uh,
Namaste, Hitayara.
Madam's introduction, let me take one few minutes to talk about her, but I think I have limited knowledge, ma'am, when I'm trying to read your profile also. So I request you, please introduction का जो भी miss होता है, please introduce that part because
No
I think
problem.
it's very important for the people to understand who you are. So she is Dr. Vasuprada Karthik. She is managing partner of Prabodha Training and Consulting Company. And she is also General Secretary, Association of Anthroposophic Psychotherapy, India. And she is faculty of National Training and also member International Federation and Editorial Task Force at Switzerland. Madam is having 3 decades of experience. She works with families, couple therapy, and also she works in hospital setting also. And apart from that, her holistic interventions in post-bariatric surgery, which was very amazing to read, ma'am. Just understood that. And she's also specialized in trauma therapy and she deals with psychosomatic issues. And her papers are published in national and international forums and publications. And University of Toronto published her work very specially. So, ma'am, we really want to understand and listen from you. The word itself is very new for us, that anthroposophic psychotherapy. I repeated and I tried not to spell it wrongly. So, ma'am, to begin with, please tell us about you little more and then tell us the concept of anthroposophic psychotherapy.
Yeah. Thank you so much for that very interesting introduction. And it's not needed so much. I'm just a humble therapist along with all of us, everyone in the community. Uh, so I met anthroposophic psychotherapy or anthroposophic medicine in the year 2004 and actually started training in 2005. So it's been a long journey. And after many trainings in India and then abroad, got my certification from Switzerland as an anthroposophic psychotherapist. Then went on to do further training to become faculty. So got certified after 6 years of good work to become the faculty. Uh, and this had a bigger vision because we wanted to be able to bring training to India because earlier it was not really available. We needed to wait for faculty to come from elsewhere. So with this been a journey. And yes, since 2017, we have officially started the national training in India. And this is the eligibility is, of course, you need to have psychopathology training in the background to qualify to become a therapist. So coming back to your first question, so anthroposophic is actually from two words, Greek words. One, anthropos means a man, Sophia means wisdom of. So it is something wherein we are talking about the wisdom of a human being, giving it as broad a perspective as possible. Because very conventionally, as we know, we talk about the human body and we talk about the human mind. But if you're looking at it from very broader perspective, then you start adding some other components to the human being. And that comes under this wisdom of a human being. So there are multiple things that have gone into it. And the father of this anthroposophic philosophy of anthroposophy is Dr. Rudolf Steiner. And he's given it to us more than 100 years ago. And the headquarters are in Switzerland. It's purely a medical system that came out of it first. And the branches are psychotherapy, and we have art, movement, and many other derivatives, including farming.
Oh.
So it's a wonderful thing because, as has been said by Rudolf Steiner himself, that this knowledge also has come from the ancient Indian wisdom.
Mm.
So it has its roots in Indian wisdom, and it has been packaged and given in a very scientific manner so that people relate to it better.
Wow.
So trained conventional therapists understand it from a very scientific manner.
Ma'am. So origin is from India, but now certification started in Switzerland.
Not really, no. I would say its wisdom is that, but the one who started was Rudolf Steiner from Vienna, Austria.
Mhm.
And then it moved on to many years of work that has gone into it. And finally, as headquarters in a place called Dornach in Switzerland, that is where everything has taken its roots. Yeah.
Got it, ma'am. Got it. So, ma'am, today's um, the title of the interview is basically about anxiety in terms of how anxiety is looked at from different perspectives.
Right.
CBT looks at it different way, REBT looks at it in different way, art therapy looks at it in different way. So how it is different when you consider this anxiety from this perspective?
Yeah. Thank you. So, as we all know, primarily when we are qualifying for anything else, we always start with the conventional model because conventionally we know we need to have a diagnosis of anxiety anyway.
Yes.
Then the way you start looking at it is different. So the lens you use will be little different.
Yes.
It's a very holistic lens, and it is different in the context of now there is an increased amount of childhood anxieties
Mm,
across the globe.
correct.
And how that is looked at is very different anthroposophically because you start looking at the human developmental phases. So we have that even in conventional model that the developmental phases are there. But this is probably what we call as the spiritual scientific perspective of human development. So the anxieties that come to a child before the age of 7 or 7 to 14 is different, then 14 to 21 is different. So each septennial, the context changes a lot in terms of the anxiety itself. So the presenting symptoms could be the same. As we know, when we are diagnosing anyone, we're looking for the similar symptoms to say, oh, this comes as anxiety.
Mhm.
But the anxiety that probably may come for a 35-year-old is looked at in a much more holistic way in terms of what all things are taken into consideration, apart from what is coming as the psychological symptoms.
Symptom
So
is
there
outcome.
are many more perspective, much more information that is gathered. And
Okay.
also the premise on which you work is that human being is extremely unique. Each human being is unique. So just like probably how we have individualized educational program, IEPs,
Hmm.
here what we have is the interventions are very individualistic. So
Okay.
even if I have two children coming with symptoms, probably how I approach will be very different considering the multiple other factors that go into making this child who he is or how he is.
Hmm.
So students, as we know, can go up to the range of the young adults. So probably even adults. So how the student counseling or student anxiety can be perceived from multiple angles,
Hmm.
taking age into consideration, familial backgrounds to, I'm not talking in terms of just the demographic data, but much more, which is very individual. Because
Hmm.
then how the reason behind my anxiety could be understood much better. And the solution comes in a very individualized manner.
Right. So, ma'am, what I understand is like for each age group, as you said, symptoms are same, but the hidden things are different, and the approach should be different.
Yes. Yes.
Okay, okay. So, ma'am, maybe for little more information, how a child's anxiety about going to school is different from, maybe adult who need to present in the forum, like he need to present in a maybe interview or a PowerPoint presentation
Yes.
in front of a
Yes.
board. So, how different both are? The symptoms are almost same.
Yes. Yes. So, probably how we look at it is first, age wise, there are specific running anxieties, as we call. Something will be there, a little bit more, which probably conventionally we say use stress, which makes us perform,
Mm,
all this. But at the same time, there could be certain factors like a child who's in the age group of, say, 9 to 11. There is a specific possibility of anxieties showing up in
mm,
this perspective. So, which we call as the Rubicon crossing years. And there are specific challenges that child feels by himself,
mm,
which may not be related to going to school at all, actually. It could stem completely from a different source, but it looks as if the child doesn't want to go to school. It
mm,
only comes out as the behavioral part is not wanting to go to school. But
correct.
it's very possible that the child is actually in a mild forms experiencing a bit of separation at that time. um, this, of course, it needs a lot more explanation, but yes,
Yes, please.
it's a strange kind of a separation anxiety that does apply to children at this age. In this approach, of course, we look at it,
Mm,
and then how you address that resolves the problem of the school. It may not be even coming anywhere from the school at all. So, how we look at it is different. And for an adult who's having anxiety about, presenting something, of course, you address the usual, very logical things that are in front of us. But what needs to also be taken into consideration is whether that person belongs to which age group,
mm,
because each age group has specific challenges that we meet as developing human beings. And those specific developing challenges or crisis points,
mm,
each one manifests, affects each person in a different way. Some may feel some highs, some may feel lows. Some go through this anxiety, of course, because we have our inner need to develop. Every human being is born with the need to keep developing from one phase to the other.
yes.
So then, where is this coming from with this adult? Supposing this one is 35 or 42 or maybe 28, then we start seeing what are the other applicable reasons behind that. So then,
Mm,
working with anxiety becomes a little bit more expanded than what ideally we just look at it as the psychological symptoms, but we look at it from a very deeper and a wider perspective.
got it. Ma'am, any specific, case, not details, but any example which is very
Yeah.
typical in your mind? Can we listen to one, case?
Okay. So I can give an example of this one child. First, I'll give an example of a child.
Mm,
So this child who was till then going to school, but suddenly started having difficulty going to school and not wanting to study and became more clingy to the mother, like not leaving her. And somehow this was very unusual because the child was fine till then. So, just like all of us, we will investigate. We would like to see whether something has happened in school.
mm,
And clearly, all those are normal. Then, what is making this child go through this sudden thing of not wanting to leave? More mother, but mostly both the parents.
okay.
So then you start wondering. Typically, if I ask a question, everyone will say there is some safety worry, some safety security worry. Maybe is
Mm,
the child afraid of something? So then what we, before, of course, not all the time children open up and say everything. So then art is a very important part of our process. So
mm,
we also work with um, some art possibilities so to bring out something from the child. Then as we engage with them and more things are coming out, then you start realizing that this child has a different possibility, because also that specific age, between the ages of 9 and 11,
Mm.
they have this worry of something that may come stem from within, which equivalents to separation or leaving or a loss. So then you start working more with the children, because we are not going with the theory. We always want to have confirmation with the case. Then the child finally, we of course use many other small models of, movement with them, some amount of speaking, making them do some other, because all these uh, multiple possibilities of intervention is another thing that is in the anthroposophic psychotherapy model. We give training in multiple approaches so that we understand how to work with each client, especially children, of course. So then suddenly the child says, I'm afraid.
Mm.
So what are you afraid of? Then he says, no, I think my parents are going to die.
Mm.
So this is something which is like, if you listen to it, then you say, where has this come from? Like, it makes no sense. Did he see some movie that worried him?
Again,
Or
try to find some
typically, we,
reason.
we start thinking. But then this is also about one idea which comes, that at these points, the children naturally start having this anxiety of losing a connection with their environment. So then it starts translating into this very normal usage of words, because they cannot express like that.
Correct.
So for them, then of course we work a lot, but in terms of using all the tools that we have in the therapeutic model. And then, yes, the child, then you just have to hold them for a little while, take them along. And the parents also have to work with this same concept, not addressing it directly, but indirectly working with the child
Mm.
to create that sense of this is okay.
Mm. Yeah,
Then it resolves. So, this is one of the very typical things that we have noticed with children. The anxiety shows up as one, probably they fight with people more, or they withdraw from people. Both happens. So not going to school or not interacting with their own age group, those kind of things happen. But the causative factor could be something wherein they are perceiving this sense of separation or loss in different ways.
got it. Yeah.
Yeah, that is for a child. But for an adult, it is more of, probably it is coming, each septennial, each 7 years phase has one specific drive or a need for a person. So if I'm attaching very strongly to it, and I attach this presentation to that need inside me, then the anxiety is much more. So we need
Mm.
to start working with these multiple factors. Yeah.
Yes. Beautiful, beautiful. So when you are talking, like, we understand, we generally look at the diagnosis and see the symptoms, and, have the, bunch of interventions which
Yeah.
can, and blah, 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 and then maybe not so deeper into the, things you're talking about,
Yes.
not
Yes.
that holistic looking at the issue. Right, right. So, ma'am, can we have the taste of the therapeutic interventions you follow in your therapeutic process? So, any one or two interventions.
Yeah. So as I said, one of the probably doables for us would be, in a clinical setting, would be to bring some very basic amount of art interventions, and
Hmm.
also how the questioning is. So the entire information gathering itself is very expanded, very, very expanded. So,
Hmm.
and it's not never in a questionnaire model ever. So it is all about a natural process that needs to happen. And one of the focus areas for us is always about something called the salutogenic approach.
Hmm.
So, salutogenic means from where the health is. So, whatever is working with the client becomes the focus point. Usually, what we have is we look at the disorder or pathology more.
Correct.
That is how conventionally we are all trained. We are trained to look at what is not working or what is the problem. But here, what we see is, well, there is a big picture. Out of that big picture, there is something that is still working with the client. And that becomes your entry point. That's where we begin from. And so that is the difference in terms of how we work conventionally as against what we are doing here. So, one more clarity I would like to give is we are still conventional people. It's just that how you um look at the client in a very expanded and a very much more deeper way, because there is something called human biography that we take into consideration, and many more. And
Hmm.
also, one more concept is to have this idea of a macrocosm, which is the biggest cosmic world, as against a microcosm, which is a human being representing everything on earth here. So it's a very holistic as we can think in terms of understanding even basic illnesses. So because I do a lot of work with psychosomatics, for me, medical biography is a very important thing. So each person's medical biography, along with what is happening with them. So that gives an idea as to what's going on with this person at the deepest level. Then our interventions are going to be according to the needs of this one and based on their strengths. So, one example I'd like to give you here.
Hmm.
So, there was this lady who had lot of anxiety issues, lot of anxiety, and was having difficulty maintaining some relations with their, whether it is with family or colleagues. So there was this getting into arguments about,
Hmm.
and so she was very depressed. She said, I mean, what is this? I mean, I'm always anxious. I want to do something better, but somehow I'm ending up having all these fights
Hmm.
with everyone. So essentially, I'm still getting very more and more isolated. So this one was, of course, in the age of about 45 or so. So there are certain things that we have as premises to work on at that age. So typically, what we understand probably is we'll say, oh, premenopausal, probably.
Hmm. We start with.
Conventionally, we'll say probably premenopausal hormonal disturbances, whatever. Yes, while we take all that into consideration, we also need to consider what are the specific things that this person has. So,
Hmm.
in the information that came along as we talked, and a lot of time needs to be spent, I had this feeling that there is something within her which needs to come out. The anxiety is coming from that space.
Hmm.
So then we started talking about certain, probably her interests or hobbies that she left behind way back, maybe growing up years or young school days. Because so then she said, actually, I used to like writing poetry. So the understanding here is when during we go through the menopausal age, what is happening with women is that our bodies are losing the creative forces, because till then you are able to create a child. Then slowly the body is losing this ability, but these forces are still within us. So, what are we supposed to do? And that's what causes a lot of distress in people.
Okay.
So, then I said, why not you create something out of your brain, your mind, your soul that needs to express itself? So then we started working on her, writing her poetry back into that stream. And this has done enormous amount of good, that she started expressing her initial was something about the fears. Then slowly it came into a completely different level. But then she had forgotten her anxiety.
Oh.
So it was, so I would say it is her own ability to write that has, helped her overcome her anxiety.
Hmm.
It's a matter of just holding and going through this. So there are many creative things that we can work with using this knowledge.
Hmm. Ma'am, when you say this, generally, the therapist or the practitioners who are already trained and that habit of looking at symptom wala, formed very strictly. So that conventional therapists may find it very difficult leaving the symptoms, leaving the psychopathology aside and working on something else, that would be very difficult, I think. So how do you look at it, ma'am?
Yeah. Actually speaking, we are not leaving aside anything. As I said,
Hmm.
the diagnosis is still in the mind. And
Hmm.
then understanding the diagnosis from multiple ways. So
Hmm.
that our interventions are very creative and very, what should I say, humanistic, more client friendly, that they are able to relate to the therapy. Because here this person could relate to the therapy probably because I was using her ability to write. So in a way, but the goal is still the same. I want her anxiety out. I want the symptoms
Correct.
out. So how this is just a very simple example I have given. They're much more uh, well,
Deeper.
it's a complex system of diagnosing, arriving at certain things. But I can tell you that the people who are certified, who are practicing in India, they're all still conventionally there in their own clinics, but very proudly doing this work because they know that they can work with doctors' cases. So, as I said, medical cases become slightly more easier to understand. Yeah.
Got it. Got it. Ma'am. So now coming to the, the last part of the interview here, as a whole
Mm.
life. So everybody want a happy life, maybe a satisfactory life, maybe a purposeful life. So how this approach or your suggestions as a therapist in this field in the context of life?
Yes. Thank you for this. I think this is the most relevant question for this approach because that is what becomes the therapeutic goal in terms of understanding what actually this person deep down inside actually has as their own understanding of their own life path. So, and this is not, we don't use our brains to do that, but we help the client to relate to their own deeper needs and relate to their own vision for future.
Hmm.
Because what I tell may not make sense to this person, but yes, when they work on it, they start having this idea of, yes, I can be there. This is what I need to do. So, how they relate to small things like whether performing in an exam or whether to probably work on their career better, or all these things are coming, ideally, they should come from within them because we are still without, we are outside. So,
Hmm.
we can only give them some directions, but the people to take the steps and to follow the path is still only the client. So, then bringing out this relationship to the possibilities, because typically when we do the inventory, interest inventory, we'll know, oh, these are all the possible things. Then if you do the aptitude, then you say these are all the possible things, but all these are there, but where is this person actually wanting to be? So then it all comes to that thing of sometimes there are too many what should I say, ambitions for a person. Maybe sometimes they just need to filter it to see really where my heart lies or where my strength lies. So
Hmm.
we can work with that. And I think one of the most recent presentations I had given in our world conference was about the concept of illusion and reality.
Hmm.
So in this present generation and present world, how it is working is it's a lot about what is created rather than really understanding your own reality. So
Hmm.
I may have some idea, or there may be an idea presented to me. Maybe that is not what it is. And then suddenly I wake up that I'm unable to do this
Yeah.
because I have not understood it well. So this waking up, maybe trying to understand your own true potential, because some people have amazing potential in something and they have not understood it.
We need
So
that.
that is where I think we need to work with, because they may have all these gifts that they have brought with themselves, which need to see the world needs to see it actually.
Yes.
So, yeah.
Yeah. when you are, in the last sentence, when you said they have the gifts, but they do not realize it.
Do not realize.
Yes, ma'am. Recently, also with one counselor, I found like I'm working with her maybe 1.5 year, but recently, a few weeks back, I saw the true potential of that girl. And it's
Yeah,
amazing. So gifted you are. Then that's where I am trying to bring
yeah,
her out to the, world and public to show her gifts of God.
yeah.
Yes, ma'am. Yes, ma'am.
Very true. Very true.
And everybody, ma'am, when you're talking, I'm thinking where, I should come one day and sit with you to understand my true potential to
Absolutely. No,
bring
no, we
outside.
do that with our friends in the sense it's good because multiple times I think we need to share also because it's very possible that you are doing something to your highest potential. It's possible there is something else also.
Yes, yes. Yeah,
और भी हो
definitely,
सकता है.
ma'am. I'll catch you, ma'am. Right. So, ma'am, finally, how, because now we see 95% of them, I don't 99, only people like you are into this. Very rarely we see this professionals into this anthroposophic psychotherapy. Now, how we can bring this modality into the clinical setting? Like we are having our clinics, we are working online with clients, we are working in MNCs, some
Yes,
people are working in the NGOs, schools, but we are doing the traditional counseling.
correct,
So
correct.
how this can be brought into that setting?
Yeah. See, we are doing pretty much all this, whatever you have said, as practitioners. We are able to um convert that into whatever setting that you want,
Yes.
especially in trauma settings is one because like when I work with our own Telangana police and our Barosa teams, and so sexual abuse, traumatic in the end trauma interventions from this perspective. So that is one thing. Apart from that, every context we can do that. Only thing is the counselors need to have the basic understanding, so which we call as the foundation course.
Yes, ma'am.
And then the ones who are qualified, who are postgraduates in psychology with psychopathology
Hmm.
as the requirement, then they get into these advanced course training and they can carry out all this in their clinical settings, in their training models, everything. Because every time this is something, when we do this foundation course also, that is open to everyone actually.
Mhm.
They find it to be one path of exploration. They say we did not know this about ourselves.
It's
So
new.
the knowledge begins with one's own self. So when we start understanding ourselves a little bit more and probably context around us, then we take this knowledge into the world of psychopathology and how the psychotherapeutic interventions come. And of course, we use them every day in
Okay.
every context. So
So, ma'am, so that basic module they need to undergo, the basic training they should undergo so that they can start exploring this field.
yeah, so basic is the foundation course, which
Foundation
will give
course.
all the concepts of why we are even talking this. So
Hmm.
it's a process because if I have to say that, like for instance, we typically know as the five senses, but here we talk about 12 senses. Now you'll wonder what are these 12?
Correct.
Yeah.
Immediately that
So
curiosity coming out.
curiosity comes in, but this is also, it gives a lot of insight into understanding probably even something what we call as curative education. In conventional model, it is the special education. So how certain concepts can be applied directly in the context of something like that using this model of 12 senses. So typically, again, there is an imbalance in a threefold human being, we'll say. That is the thinking, feeling, and willing human being. So a lot of things that are there in multiple models that are given, it's a beautiful journey. I mean, everybody enjoys this foundation course because there are a lot of interesting things that come about. And as is the natural way of living, everyone likes to know about themselves also. So
Got
when we do a lot of exercises, then they relate to the concept.
uh-huh.
And they say, yes, this can be applied now. I understand how to do this. So it's good because, as I said, this is not something out of the way. It's just that we are giving extra amount of things to use our own already existing knowledge.
it is an added thing to
Added thing. So we want everyone to be conventionally trained. Then only they are ready for this. So yeah,
Mhm.
our first batch of people were all psychotherapists with 25 years of experience. So that was then. But of course, we see a lot of enthusiastic new people now coming in, and they're doing a marvelous job. As they are getting trained, they are already full-fledged taking the concepts into their clinical practice.
Yeah.
So
How
yeah.
long the training would be, ma'am? Just for
Uh, well, to get actually the international certification as a psychotherapist is the period requirement is 4 years.
uh,
So it's all on and off kind of training. It is done in modules,
uh,
and so
this foundation course, ma'am?
foundation course is for about an year, and this also online is available. And also, I'm saying online, but primarily we still prefer offline. Uh,
Mhm.
but counselors enjoy it. I mean, anyone who's doing it. Actually, right now, in one of the batches, we have a retired civil engineer,
Wow.
and he's enjoying himself. He says, "Ma'am, I wish I had known. I would have changed my line earlier." But this is only a foundation course for the concepts.
Yes.
But then, once that part is done, then you move into the advanced course, which is totally about dealing with the clinical settings. Yeah.
So finally, what is your message uh, mm, to this budding psychologists?
Yeah. So for budding psychologists, my message is one, always be ready to gather as much knowledge as possible about any model, because each one that you're getting trained in will help you become a better therapist. So, and also do have some amount of, I would still say, connection and respect for our own traditional models, because they gave us a lot of wisdom. Uh, Probably, if they said something like we should take very good care of a woman who's expectant mother, it's not just out of something. There is a bigger meaning and a perspective around it. So yeah, that's what I would say, to expand yourself as much as you can, because then you enjoy your work as a mental health professional so much more, because you have so many tools with you. You can use this, you can use this, and it's a
Yeah,
marvelous thing. And when you have a guide like Dr. Geeta Garu, then enjoy yourself, learn as many things as possible.
right, ma'am. More weapons in the hand.
More,
Yeah.
more weapons.
Right. Thank you so much, ma'am. It was very insightful discussion with you. Now, some of them want to ask questions.
Yeah,
We'll open the mic so that they also ask questions and feel
sure, sure.
comfortable. Yes, we can take few questions only. So please raise your hand virtually and then you're allowed to open your mics. Unmute yourself and ask the question very quickly. Yes, Lata.
Good morning, ma'am. Good morning, both of you. Ma'am, I want to know, in this epoch of artificial intelligence buzzing, I want to know the role of creativity and further course of people's threefoldedness that you just mentioned, the change in the threefoldedness in terms of their thinking, willing, and feeling. Because how is it going to impact the subsequent generations having the influence of AI and creativity in between?
Thank you for the question. It's a very deep question. I would love to probably have an entire session answering this, but I will still tell you that yes, the basic balance of this three-four human being completely gets lost, and we primarily are just in the cognitive space. So do not forget that artificial intelligence is not doing its job on its own. It is still created by human beings. But what is happening is that we depend on other things rather than using our own creativity. Like, for instance, now I know that people take a lot of help in trying to even write their resumes. I mean, it's your life, write your resume. But why are you taking electronic help to do it? So it shows that we are slowly likely to disengage from our own lives and our own selves, because we become more robotic and mechanical in our thinking and, of course, even feeling realm. That's also the reason why we have a lot more relationship problems right now than we ever had before, because people want a controllable robotic person, not really a live human being. More often than not, it's the truth. So the more we get into this, I'm not against technology. Without technology, you and I wouldn't be talking now. But it is also using the wisdom, how to use it, when to use it, for what purpose. Because all the robotic, artificial intelligence, everything is helping amazing things in the world of medicine and many other possibilities that we have, which we are very dependent on. But the simple thing is, if I ask you to tell me 10 mobile numbers, can you tell me?
No, ma'am.
No, because we stopped using our brains. We started looking at, we open the phone and we click on the contact. We have stopped using that ability. So, in a way, to be conscious that we have our potential, that we can do a lot more cognitive learning, we can do a lot more feeling things. So, if I ask people what is more popular now, whether to work with paints and brushes or to do digital art, everybody says digital art. Can you tell me why? Because it's easy to erase.
Correct.
Yeah, so that is what is happening to us within, where we have forgotten that it's okay to make mistakes, it's okay to recorrect, it's okay to work with. So, this basic relationship to our own lives and ourselves now has become very small. And we should be very cautious about using technology for unwanted things. As long as we are human beings alive and doing our work, we should use our abilities as much as possible. And reaching out to the next human being probably is the best way to do it. Yeah. Thanks for that question. I really like it. And generational, yes. If they see um, people who are more robotic in nature as parents, then children do not know how to process their feelings at all. They don't learn anything.
Yes, ma'am.
So it's going to impact generation after generation.
Yeah. Thank you.
Can there be a subsequent question? Or
Yes, very quick because we have very less time. It should be very specific question.
yes, the thing is, I understand that is misusing of technology. However, people, if at all I approach somebody, there are so many perspectives of one particular topic. If at all I'm approaching someone, there are so many perspectives. The
Mm.
listening ear is something that I may not have in alignment with the person from whom I'm hearing, whereas an AI can give me exactly what I'm looking for in terms of help. When I approach AI for help, I understand that it's not going to judge, Whereas if I approach a human being, there is a judgment. There is always an ear which is somewhere which is judging. So should I approach AI?
No, I would still say
Ma'am.
learning to interact with people still is our big task. As I said, that is where we lie, because without it, no man is an island, and we should not be. Human beings are supposed to be together. So, if they are not listening to you well enough, then they should learn how to listen. And if you're not listening to them, then maybe you should learn to listen, because that is what is the most important task for us as human beings, is to remain human beings and develop ourselves further. Yeah.
Thank you, ma'am. Right, shall
Thank you.
one more maybe question last. KJR, I see KJR raising the hand. Right. So always ma'am is available anytime we can, share the questions and get the information. Ma'am is very approachable and we'll be definitely planning for one, a brief session with you, ma'am, for our counselors. Uh, I don't know whether it is 1 year, it is too long for
No,
us.
no, not that way. We
We
will
can
see
have a
how best we
small
can have a
course,
model,
ma'am.
because no, getting the fundamentals is one level.
Right.
Of course, when you have qualified people, ideally they should be certified. They enter into a different realm of working. It's good. They'll use their skills. So whoever is interested, of course,
Yes,
because
ma'am.
I see that um, people are afraid of committing long time. But this is not a full long time. You're still doing your job, you're still doing everything. But yes.
Yes, ma'am.
Uh,
Yes, Ram is asking, does this located in Hyderabad? Is the
yes.
course? Mhm.
Yeah. It is located in Hyderabad, but yes, we also have trainings elsewhere. Um,
Yeah,
so
get in touch.
the foundation course gives you the flexibility to have offline, online combination trainings. So that's the reason we have people from different spaces. So right now, we have had the pleasure of certifying a very senior physician who's also oncology trained from Bangkok, got certified just this year. I was there with him in Switzerland when he was receiving his certification. So it's good to have different groups of people who come in, and so we will have this. And you see that the more we meet others, we see how successful they are being uh, in their own clinical work. That sharing of knowledge. Yeah.
Thank you. Thank you
Thank you.
so much, ma'am. Thank you so much. So the Psy interview on ma'am, I'll repeat. Anthroposophic psychotherapy was
Yes.
wonderful. And we look forward to have a brief session for our counselors, Manojagriti members.
Yes.
We'll approach you and we will trouble you, ma'am. So
No, my pleasure, my pleasure. Because we are here to spread this knowledge, just so that you feel so much more. Again, you say, yeah, I have some more tools to use.
correct.
So that's the whole idea. It's not real about anything. It's just that I remember the joy I had when I heard the first lecture or met the person who was just doing this in the year 2004. Though the training started that year, I couldn't manage because I had certain health issue. But 2005, I was there and never looked back. And I'm grateful for the opportunity that came about like this. Um, because yes, somehow it's like you get that feeling, just like all your other trainings, whether it is REBT, each one, when we get a tool, we say, wow, this is so good. The
Yes,
joy of saying I have one more tool.
yes, ma'am.
So yes, thank
Thank
you
you
very
very
much,
much, ma'am.
Geeta Garu and
It
Manoj
was a
Agrati.
wonderful
Yeah,
discussion with you. We look forward to have one more session in a different
yeah.
day. Ma'am, thank you so much.
Bye bye. Thank you.
Thank you all for joining.